Lately, I've had patients, friends, and family asking me the same question. Should I be taking peptides? They're being marketed for everything from faster healing and muscle growth to anti-aging and longevity. Some people are even injecting combinations called the Wolverine Stack. But are these products actually backed by science? I'm Dr. Raj, board certified family medicine physician, here sharing quick evidence-based health information. Now let's talk about what peptides are, what we know, what we don't know, and what actually works if your goal is healing and aging well. First, let's define what a peptide actually is. Peptides are simply short chains of amino acids, and amino acids are the building blocks that make up proteins. Think of amino acids like individual beads. A peptide is a short string of those beads connected together. When that chain gets long enough, we stop calling it a peptide and call it a protein. Now, here's something many people don't realize. Your body naturally makes peptides all the time. In fact, some very important hormones are actually peptides. Endogenous insulin, oxytocin, several hormones involved in growth and metabolism are all peptides. These molecules act like messengers that tell different parts of your body what to do. In fact, doctors have been using peptide medications for over 100 years. Synthetic insulin is probably the most famous example. Today, there are over 130 FDA-approved peptide drugs on the market used to treat conditions ranging from diabetes to cancer, including some of the more popular GLP-1 weight loss medications. So peptides themselves are not new, and they're not inherently dangerous. But, and this is very important, the peptides being promoted on social media and sold through many wellness clinics are not the same thing as extensively researched and approved medications. Most of these compounds have not gone through the rigorous testing required to prove that they're safe and effective in humans. And that's where things get complicated. Let's first, though, separate collagen peptides from the rest of this discussion. Collagen peptides are oral supplements, not injectable drugs. They've actually been studied in humans, and the evidence suggests they may provide modest benefits for joint pain, skin hydration, and skin elasticity. Notice I say modest. They're not miracle supplements, but they also don't carry the same concerns and risks as many of the injectable peptides we'll discuss next. Most of the excitement online centers around peptides like these. The issue is that most of these claims are based on animal studies, laboratory studies, or theory, not high-quality human clinical trials. In other words, promising maybe, proven no, and that's a really important distinction. Let's take the popular Wolverine Stack, which usually combines BPC-157 and TB-500. Despite the hype, we don't have good human safety data on either compound, let alone on that combination. We don't know the long-term risks, we don't know the optimal dose, we don't know who should or shouldn't take them. Some peptides may affect growth hormone pathways through chronic elevation of growth hormone and IGF-1, which can increase blood sugar, cause fluid retention, and affect metabolism. Others influence blood vessel growth to accelerate tissue healing. However, this chronic upregulation of VEGF is a cause for concern, as it can theoretically accelerate blood flow to and therefore growth of undetected cancer cells. And finally, one of the biggest concerns is quality control. Many of these products come from unregulated sources. Independent testing has found mislabeled products, incorrect doses, impurities, and contamination. So when people say it's just a peptide, that's not the whole story. You may not even know what you're injecting. Here's the part no one wants to hear. The things that consistently improve healing aren't very exciting, but they work. If you're recovering from an injury, physical therapy, progressive strengthening, adequate protein intake, sleep, managing diabetes and avoiding smoking, gradually returning to activity. All of these work. These aren't flashy, they don't make for viral social media posts, but these are the interventions that repeatedly show benefits in human studies. The same thing is true for healthy aging. There is currently no peptide that has been proven to reverse aging in humans. What does have strong evidence? Regular physical activity, resistance training, a diet rich in minimally processed foods, drinking plenty of water, getting 7 to 8 hours of good quality sleep every night, managing stress, controlling blood pressure, cholesterol, and blood sugar. These habits may not sound as exciting as the latest anti-aging peptide, but they have something even better: decades of evidence showing they improve health span and longevity in safe, natural ways. Here's my bottom line. If your heart is set on taking a synthetic peptide, collagen peptides are generally safe with modest evidence for skin and joint health. But most of the injectable peptides being marketed for healing, anti-aging, and recovery are still experimental, and the hype is running far ahead of the science. Until we have better human studies, I'd be cautious about spending money or taking risk on products that haven't yet proven they deliver what they're promising without potentially causing irreversible side effects. If there's one thing I hope you take away from this video, it's this: the foundations still matter most. And while these may not be as exciting as the latest peptide, they consistently outperform shortcuts when it comes to healing and aging well. If you found the information in this video helpful, let me know in the comments below. I'd love to know if you've tried taking peptides or are you considering them. And until next time, be well.